Okay, so first of all, good afternoon, everyone, and welcome to this webinar today, where we're going to be discussing for this webinar the heart failure QOF domain. So we're going to talk about the requirements, and we're also going to help you to understand how we can help you to deliver it as well. Now, this webinar is for EMIS practices only. So if you are a System 1 practice, unfortunately, yours is not now. Yours is actually happening at 1:30. So what we'll do is we'll finish this one and then we'll join the 1:30. I will get the colleagues just to pop the link into the registration so that you've got that as well. Should I introduce myself? That would help. So my name is Charmaine Jackson and I head up the training team for Ardens. And I'm also joined by my colleague, Mariette Hadfield, who is one of our training specialist leads. Okay, so in terms of housekeeping, you're not connected to a camera or a microphone. If you do have any questions that you would like to answer, then please take time to find the Q&A option, and we'll be happy to answer your questions as we go along. Have also got my colleague Alex, who is one of our developers, who's going to be joining us to help with the questions today. And we are going to try and keep to 30 minutes today. This is a short, sweet webinar, just making sure that you've got all of the information that you need. And the session is going to be recorded, so we will make sure that we share the recording after this session today. So in terms of what we're going to be covering, we're going to start with a summary. We're then going to go into a live demonstration. We're then going to discuss next steps, and then we're going to talk about ongoing training and support. We're going to answer a couple of poll questions, starting with now. So if Mariette, if you don't mind launching the first question, and this is just to help us understand what your job role is. So if you just take time just to pop a question, pop your answer in there, let us know whether you're an administrator, maybe you're a GP or a HCA. It just gives us a good idea of who we've got in the room today.
The numbers are starting to pop in. So mostly administrators.
Okay, perfect. Brilliant. Thank you. We've got a few clinicians, which is good. We've also got some practice managers and pharmacists as well, which is great to see too. Okay, so next question. We really want to understand now how you're currently feeling with the heart failure domain. Do you feel that you're quite confident in this area already, or do you feel actually that you're totally confused, you need some more support? And even if you do say that you're totally confused, that's absolutely fine. That's the reason why you're here today. We want to be able to help you as much as possible to give you a clear understanding of exactly what you need to be doing. So we're going to fire off another poll question now, just to get an idea of what your confidence levels are. 1 being, I am totally confused in this area. 5 being, yes, I understand it and I feel confident in implementing it. And then you've got anything in between. So your 2s, your 3s and your 4s. If you let us know where you are, that would be great. Perfect. So kind of mixed really compared to the obesity one. So with obesity, we had a lot of people who were really unsure about that domain, and it's probably because it's quite new for this financial year, whereas heart failure, there's been a couple of changes, but not massively in this area. What I will say, if any of you didn't make our obesity webinar that we did, I think it was last week sometime, we will make sure we share the recording to that one too, so that you can access that recording if you feel that you still need some support in that area. But thank you for those that have completed that poll, and it's good to see that, you know, you're not very totally confused, you've got some idea, and hopefully by the time you leave this webinar today, you'll be even more clearer in what you need to do. So what I'm going to do now is I'm going to pass you over to Mariette, who's going to give you a summary of all of the different requirements, and then you're going to come back to me to do an EMIS demo, and then back to Mariette to do an Ardens manager demo. So over to you, Mariette.
Thank you, Charmaine, and good afternoon, everyone. So for today, we're going to start off first of all with the heart failure registers. Now, although you don't get paid for the registers themselves, I think it's important just to understand how they identify the cohorts for each one of these different indicators. So you'll notice that there are 2 separate registers for the heart failure domain. Your first one is HF1 Reg, and this one is looking for patients with an unresolved diagnosis of heart failure. And this one is in use for HF007 and HF008. You've then got a second register, which is HF 3 reg, and this one is looking particularly for those patients with unresolved diagnosis of heart failure, where their heart failure is due to reduced ejection fraction. And this one is specifically used for the indicator HF009. So now that we know what the registers are looking for, if we now take a look at those indicators themselves. Now there's 3 different indicators for your heart failure domain: HF007, 008 and 009. So I'm actually going to start off by covering HF008 first, because this one relates to the diagnosis of your patients. So with this one, there's 2 points to cover on here. So this one particularly looks for those patients on the HF1 register with a heart failure diagnosis recorded on or after the 1st of April 2023, whose diagnoses have been confirmed by an echocardiogram or specialist assessment in the 6 months before the diagnosis date. So with this particular one, to achieve it, you need the diagnosis code of heart failure, as well as that confirmation of the echocardiogram or specialist assessment. Now, sometimes you do get patients who register at your practice after they've been diagnosed. So for those patients who haven't had that confirmation already with an echocardiogram or specialist assessment, you will have 6 months from the date of registration to complete that confirmation part of that one, so that you don't get penalised on that front. So your HF008 is worth 6 points, and it's quite a high threshold. You've got 50% on the lower end and 90% on the upper threshold. We then move to look at HF007, which is all about the review of these patients with heart failure. So with this one, again, it's looking at patients on that first register, HF1, who have had an annual review completed within your reporting year. So this review must include an assessment of functional capacity and a review of their medication. So when you're thinking about achieving this indicator, you cannot just record that you have completed the annual review. It's also about recording your assessment of functional capacity, which relates to the New York Heart Association classification, as well as reviewing of the medication and completing that code on that one. So this indicator has 1 more point, so that's a total of 7 points available. And again, the thresholds is the same, 50% on the lower end and 90% for that upper threshold. Now, looking at the last indicator here, HF009. So this one relates to medication therapy for these patients. So this one is looking for that second register of patients, so the ones with unresolved hypertension, where it is related to reduced ejection fraction. And to achieve this one, it's for patients who are currently treated with all 4 of the recommended treatment groups. So they must have either an ACE inhibitor, an ARB or an ARNI, they must have a beta blocker, they must have an MRA, and they must have an SGLT2, unless, of course, it is not indicated, contraindicated, not tolerated, or they've declined, or any of those PCAs. So remember that each one of those 4 different treatment groups do have their own sets of PCAs. So if it's not suitable for a patient, you can record that. Now, the one thing to say about this particular indicator is you won't actually see your achievement for this one until the last 6 months of the QOF year. And that's the case with all medication-related indicators. So it will look for an active prescription within the final 6 months of the QOF year, so October onwards. In the meantime, of course, make sure that your patients are prescribed the relevant medications, and obviously if any of them have declined them or they're not suitable, mark the PCAs. Then everything is set up for later in the year, and just check that they are actually taking those medications on a repeat basis. And that should achieve the indicator for you. So hopefully that is all nice and clear for you. So what we're now going to do is I'm going to hand you back to Charmaine to show you how the resources help you to manage this domain.
Thank you, Mariette. That was really helpful. And do give us the thumbs up if that makes sense so far, and the work that you need to be doing within this particular area. I'm now going to take you into, I'm going to start with, thank you for the thumbs up. I'm going to start with the searches. And let's first of all look at how you can identify your outstanding patients. If you go into the population reporting module, and within the population reporting module, if you click on Ardens searches, and then within Ardens searches, you've then got a folder for contracts QOF 2627. And hopefully you will have this folder. We are currently on version 1.3, so hopefully a lot of you will have that in there. And what you will notice is we have updated this slightly now so that it's broken down by conditions, smears, and vaccinations. Now for your heart failure, that'll be under conditions. And what we're looking out for first is the outstanding folder. Within that, you have heart failure. And this will let us know patients who are currently outstanding for that particular indicator. So for your H007, you've also got for your HF008, and you've got for your HF009. So if I want to identify exactly who those patients are, then I just simply click on the population included tab. So for instance, for 08, I've got 5 patients who still not had that echo or assessment. I can go into population included, and that will then let me know exactly who those patients are. From here, I can access their record if I need to. But remember, if we are inviting these patients in as part of our recall system, then we should be picking up these patients throughout the year anyway. So that's how you identify who is still currently outstanding. Now, how it is, so moving on from the outstanding then and looking at how we can record data more accurately, this is where we can use the Ardens templates, and it's really important that we're making sure that staff in our practice are actually using the right template as well. So I'm going to show you how to access the template when it comes to recording information. I'm going to go into the patient record now, and please do note that the patients that you see on screen, these are all dummy patients, so any of the information will not be real information. And what we would say is they access our heart failure template. So if all they're doing is a heart failure review, then they can access that individual template. If they are seeing a patient with more than one long-term condition and they're using our recall system, then they may want to then use the LTC review template. And I'm going to show you both of those just so you can see where you can capture the information. So if I press F12 on my keyboard, what that would do is that will launch the protocol launcher screen. And just encourage all of your staff members to add the all template launcher protocol, because this will take you to the various different templates that we have available for you. Opening up this protocol, I've then got the option for chronic disease templates. And within that option there, I've then got the option for heart failure. So just make sure that they are using this one when it comes to capturing all of those different indicator requirements. Just wait for that to launch quickly, and then once we access it, I can show you how they can capture the QOF requirements. So the very first page they'll be presented with is the contracts QOF page. So this is anything relating to QOF requirements for this financial year. We do encourage them to use the rest of the template because that's where they can record best practice information. But within the contracts QOF page, they can have a look at the heart failure register. So if you remember when Mariette was speaking about the 2 different registers, and the second register, which is the HF3, is particularly looking for those patients who have the ejection fraction code, then this is the code that they should be using in order for the patient to be on that particular register. So that's your register. Moving down, you then have your requirements for HF007. So this is you completing a review for the patient, making sure you got that review code in, and also making sure that you've got that medication code in as well. Here's your assessment of functional capacity, which also needs to be entered as well. So providing the patients have got those 3 codes here, as well as all of the information they need to capture in general for that review, then the patient will meet the HF007 indicator. This is for your HF008, so remember the echo code or the assessment code, so it will have both of those in there, needs to be done 6 months before the diagnosis. So we're letting you know exactly that's what you need to do, and we're also providing you with the right codes that you should be using. Now the way that our templates work, they are smart working. So if you see a green tick, that means that the patient meets that particular requirement. So this patient is on the heart failure register, and for this year so far, HF008 has been met, but I haven't done the review for that patient yet. So if you see a red exclamation mark, that basically means it's still outstanding. So they'll go ahead, complete the information that they need, and then also as well capture any best practice information. What you won't see on there, I believe, is the HF009 because that's all around prescribing medication. But for your 7 and your 8 and your register, you will be able to complete that in the template. Now, if this was being done as part of an LTC annual review, what I can do, again, F12, and make sure that I've got the LTC annual review protocol on my F12 key. When I go to launch the actual template, so I'm going to hit that I'm doing a review. Wait for it to load. My EMIS is just going very slow this morning, so apologies. Might be a good chance to check in to see if there's any questions, Mariette. I'm just looking. I don't think there is any questions, is there?
No, no questions so far.
Okay, fine. So this has opened up the LTC review template for me. And then on the left-hand side, I've then got the heart failure page because this patient has heart failure. So this is all smart working here. So these pages will only show up if that patient is on that particular condition register. So again, here's a heart failure because the patient has heart failure. I can complete the review, I can complete the assessment, and all the information I need to capture for QOF. Now, within the LTC review template, it's slightly different. You've got stars next to the fields where it is a QOF requirement. So that's how you actually record data, and hopefully that makes sense so far. Just moving on then, so if I go back to the reports now, just so you can see what else we have available in there. So back in my contracts QOF folder, back in conditions, I looked at outstanding, but we've also got case finders too. So again, heart failure. So what this is looking at is patients who are potentially missing off your practice disease registers because of incorrect coding, or it might mean that the coding has been missed altogether. So these patients are not sitting on your practice disease registers, so therefore you can't complete the rest of the work for the indicators because they haven't even got as far as the actual registers themselves. So with the case finders, we always recommend that you run these regularly. I would say monthly, even sooner than that if you can. And what you're doing, your clinician is running these reports here. They're checking to see why potentially the patient should be on that heart failure register. They're going in, they're investigating the record, and then they're putting in the right diagnosis code. And if they're not sure, they can go back to our template, go to that heart failure register section, and pick up one of the codes within there. What you also have is time sensitive. Now for your heart failure, the 008 does have a time frame that has to be met. And if you miss that time frame, you're not going to get paid for that patient or for that particular achieving that particular indicator. So remember we said in order to meet the requirements of HF008, patient has a new diagnosis, but they have to have an echo or specialist assessment within 6 months before that diagnosis date. Or if you're a brand new patient, 6 months within that registration happening. So therefore, this is telling you that these patients are eligible, but they haven't had an echo or specialist assessment yet. There's still time to do them. And we've given you a countdown here. These patients only have 1 month left before they miss that indicator. These patients here have up to 6 months left before they're missed off that indicator. So for your time-sensitive reports, make sure you're running these weekly because you want to make sure that you're picking these patients up as quickly as possible so that you're not missing out on their care and also payment for this particular indicator. So that's your time-sensitive. Case finders run monthly, time-sensitive run weekly if you can. Then the last couple of folders I want to show you before I pass you over to Mariette is the data quality folder. So this is where you're doing all the work, but potentially you've got the code wrong. And this is mainly for HF008. So this is saying here, like, we've looked into all of these patient records, but the code that you've used for the referral for the echo is wrong. So therefore, it's not going to be picked up as achieved for that indicator. It's a case of running that report, seeing who those patients are and amending the record with the correct code, remembering that you can use the template to be able to do that. And then lastly is your achieved folder, and you've got heart failure in here. And this is just saying these patients have all met the requirements for that indicator. So this is kind of how you're doing at the moment, so that you can manage your progress throughout the year. So hopefully that makes sense. Any questions, Mariette, or anything that we want to add on to that at all?
Yeah, there was just one about the template itself. Somebody asked here, where do we add the code if diagnosed by cardiology? We have someone who have no echo, but the cardiologist have diagnosed and treated them as heart failure.
Was you going to answer that at the same time? Sorry,
I was going to ask you on the template there, if you could just show where they could record that information.
Okay, you need to bear with me. Have we got Alex on the call as well, Mariette, or is he not here?
I haven't seen him join yet.
Okay, let's have a look. Otherwise, we can take that question back. And just remind me, what do they want him to record? Diagnosed by cardiology.
Yeah.
We're looking at the diagnosis codes then. I don't.
Because they don't have an echo because they were diagnosed already in secondary care.
I'm not sure if we have got that code, so it might be the case.
There's an exception just underneath that one.
You've got the
exception for echo.
Not indicated.
I guess that potentially could be used if cardiology is already, but that's something we could take away and just confirm.
Yeah, I think so. Let's just confirm that just in case. I don't want to be given the wrong answer as well. Yeah, we've got several codes there. So we will, actually, I think there was one in there. We would take that back if that's okay, and we can get back to you.
Lovely, I'll add it to our list. And the only other one in there was, will the template be updated to be able to add exception codes for SGLT2s and MRAs? Because currently it only includes it for the ACE, ARBs and beta blockers. Again, I think that's probably one we would take away.
Yeah.
Lovely. Okay. That was all the questions so far.
Then. Thank you. I'll pass back to you then for manager.
Lovely. Thank you. Just swap my screen. So we're now going to have a look at Ardens Manager. So for those of you who subscribe to the national content of Ardens Manager, I'm on the QOF dashboard here, and we are looking now just at the heart failure section. So within here, you'll see that everything is split out nicely for you. So it's categorized. You've got your diagnosis. So that's your HF008 indicator on here. You can also see your personalised care adjustments, and then you've got those final two review elements there for HF007 and 009. On this dashboard, you've also got access to those time-sensitive searches that Charmaine mentioned, so you can have a look and see how long is left for patients to be able to achieve that. Now, with your QOF dashboard, quite easy to see what your current achievement is here. So we've got these nice tracker bars with the dark grey colour showing how close you are to that minimum and maximum threshold, which is the dotted lines here. You've also got the traffic light system in the middle of the screen here for the achieved side, so you can quickly and easily see if you're red, which is below that minimum threshold, amber working between the two, and then green, which is where you want to be for maximum threshold. In the remaining to achieve side, we've got quick access here to show you how many more patients you need to get to that maximum threshold for the indicator. To access the patient lists for these indicators, we can click the view button just next to the report, and that will open up the report breakdown. Just to mention as well that within your HF008 indicator, we have also linked in those time-sensitive reports for you, so you can just view them all in one screen. So we can quickly see that I've got 21 patients on my demo system here where the time has actually expired. In terms of accessing your patient list, you can quickly click on the patient tab, and this will show you whether your patients are done, meaning they've achieved, or they're still left to do. And of course, filter at the top here just to show those remaining patients only. From here, you can either then export the full list to CSV or to your EMIS web import, so you can invite these patients in, or if you still need to have a look through their record to see if there's anything that you can do about that echo. Finally, just to mention that you have got the view button for each of these patients. Now, this one shows you the single patient view, which is a really good screen that will show you absolutely everything that is outstanding for this patient. But in terms of QOF, because that's the bits that we are looking for, you can then click on this contracts tab and that will show you what is outstanding from a QOF perspective. So we can see for my dummy patient here that both of those indicators are still outstanding. And then I can quickly open their record using the Open In button just in the top corner on there. So that concludes the Ardens Manager side of it. Just popping back to the presentation here, just before I hand you back to Charmaine, just want to check if there was any questions that we need to answer before we move on to next steps.
No, but remember, if you're not currently an Ardens Manager user, then you can sign up for a free 1-month trial. So we will make sure we'll pop a link in how you can do that, just in case you're not and you feel it would be useful at this time. Thank you, Mariette. Okay, so where do we go from here then? So we have now created a support article all around the QOF requirements for heart failure. So that includes reminding you of what those indicators are and all of the different resources we have to support you. So we have shared that on the Q&A, so make sure you do pick that up. We've also shared the obesity one in case you missed that one from the last webinar too. We really strongly recommend that you either use Ardens Manager or you go back to your reports and you identify who your eligible cohort is so that you can start planning that delivery. And maybe that's something you've done already. Hopefully you don't have massive numbers in this area, but it's definitely worth considering and making sure you're looking at the different points and thresholds that you need to meet as well. And then also ensuring that your clinicians are using the correct template. That's so important, making sure that they are using the latest Ardens ones to ensure that they're using all of the right codes that they should be for QOF purposes. Next slide, please. Now, in terms of training and support, we are here to help you with all of our different resources, not just QOF. Remember, training is free as part of Ardens. So if you do want to book on to any training, then you can contact us at training@ardens.org.uk and we'll be more than happy to assist you. We also have a really helpful support team who will be able to answer any questions that you may have from this webinar or anything on our resources, and you can email them at support@ardens.org.uk. You've also got the support article link there, which we've already shared with you too. And I think that brings us nicely, we're nearly to the end. It's also worth mentioning that we are doing a QOF training program currently. We have delivered 3 of those sessions already. So we started with the obesity domain. Recording is now available. We also done a webinar around an introduction to QOF. So this was anyone who was completely brand new to this area who wanted to understand the key principles. So if you've got any new staff, then this is a really good one. Recording is also available on our website as well. We'll post that shortly. Tuesday, we did a webinar all around helping you build a QOF delivery plan, particularly using Ardens Manager. And you can see there that we've got a number of other QOF webinars coming up. So it's definitely worth you having a look at our website and making sure that you're registering onto those different webinars if you feel they would be useful. And that then brings us to the last slide, which is feedback. So if you do have any feedback that you would like to provide out of this webinar today, if you just scan the QR code, it only takes less than a minute to actually complete it. Give us your feedback on how you felt the webinar went, what you think of the content, and also any suggestions for any future webinars. And this is kind of the reason why we put this one on, because when we done the obesity webinar, someone said, oh, can you do heart failure next? So we delivered that. So if there's anything more that you're struggling with QOF-wise and you want us to hold a webinar on that, let us know either in the Q&A or feed it back into that feedback form there. And I think that's everything. So bang on 1 o'clock as well. So 30 minutes. I just got a message back from the developer saying that they will look at the templates with the questions that we had around the exception codes for 009 and also the cardiology. So bear with us on that and we'll get some answers across to you. We'll have your email addresses because you've registered with us today. Perfect. Well, thank you very much. If you are a System 1 user as well, we will be doing this webinar again in half an hour. So we have put the link on the Q&A for you to register to that one if you feel it would be useful for you. But other than that, we really are appreciative for you coming on to the webinar today. and hopefully we'll see you on one of our next ones going forward. So thank you very much, everyone, and we will speak to you all soon. Thank you.